the side effects of cancer treatment can be just as crucial as the treatment itself, but how does supportive care fit into the equation? I'm getting some clear answers from a respected expert in this Patient Empowerment Network Restore program. Dr. Ligibel, could you speak to some available supportive care options and how can patients work with their healthcare team to effectively incorporate supportive care into their treatment plans to manage side effects?
Absolutely. And this is such an important topic. I think sometimes people want to downplay the symptoms that they're experiencing. And so they don't tell their healthcare team when they're experiencing nausea or fatigue, or they're just feeling really down because of the effects of their cancer treatment. And these are all areas that supportive care treatment modalities can really help people feel better during their cancer treatment if they talk to their oncology teams about the symptoms they're experiencing, because there are so many supportive care options that are available now. These options really run the gamut. So there are supportive care medications. We know that there are really effective medicines for nausea, for example, and sometimes people need different nausea medicines than what was initially prescribed. So really important if you're experiencing nausea, despite the medicines that you're taking, to talk to your care team about that. There are medications additionally for pain when people develop nerve damage from treatment. Those are other things that there are supportive care medicines that can be really important. And really help people feel better. Then there are other types of modalities that people may seek out themselves, things like exercise or changes in nutrition. I always recommend that people talk to their healthcare teams before incorporating any kind of supportive care into their treatment protocol, especially if they're currently receiving treatment for cancer. But there are many different ways that people can help themselves feel better by being more active and by making sure that they're consuming enough calories, making sure that they have enough protein in their diets to really support themselves through treatment. Then there are supportive care modalities that are directed toward particular symptoms, and there are what are often called integrative therapies. And integrative therapy is a type of treatment modality that really takes the best of both Western medicine and Eastern medicine to try to help support people during their cancer treatment. Integrative modalities often include things like yoga and acupuncture and massage. And there's a growing literature showing that these types of interventions can also really help support patients during cancer treatment. There's also meditation and mindfulness, because we know that cancer and cancer treatment has such an effect, not just physically on people, but also emotionally. And really managing the emotional effects of cancer treatment is incredibly important to feeling better. And so this is an area where there's a lot of active research, so many more ways that we know now can help people feel better during treatment than even 5 years ago. And so it's important to talk to your care team about the side effects that you're experiencing, and really to be open to different types of supportive care options to help you feel better.
Okay, thank you. Dr. Ligabel, what factors should patients consider when discussing supportive care options with their providers, and how can these therapies help enhance their overall treatment experience?
Absolutely. And I think one of the things that we've come to recognize is that it's often easier to prevent side effects than it is to treat them once they've already occurred. And so I think it's really important for people to be proactive and talk to their oncology care providers from the very beginning about what kinds of side effects they may experience as a result of treatment, and thinking about preventative strategies as early as possible. We were reviewing all of the evidence looking at exercise, nutrition, and weight management programs for people currently receiving chemotherapy as part of a project through the American Society of Clinical Oncology, and saw really consistent evidence that for people who started exercising even before their cancer treatment started, they were much less likely to experience things like fatigue. They were much less likely to lose strength or mobility. They were less likely to suffer from anxiety or depression, and they had better quality of life. So really starting that type of program as early as possible is definitely something that we recommend. But it doesn't mean that those types of changes couldn't have value no matter where you are in your cancer trajectory. And there have also been studies that have shown that exercise can help treat fatigue once it's developed, can help people regain strength. So it's never too late. But I think that for many supportive care options, the earlier that you start them, the more benefit you may derive.
Okay, thank you. You heard it here directly from Dr. Jennifer Ligibel. Thanks for joining this Restore program. I'm your host, Lisa Hatfield.